Welcome to Western Perspective, I'm Taylor Hanna. With the state election less than 8 months away, all candidates are in full-on campaign mode. One of them is Nicole Robins. She is the Liberal Party candidate for the Bicton electorate and an experienced young city councillor at the age of 29. So how does she juggle her responsibility as a newly minted mother and her campaign trail? Here is a personal interview profile.
You have been in council politics for such a long time. I've seen you around, knocking around here and there. It can be quite rough sometimes. So what gives you the courage to run for the second time? Because the first time you run for Fremantle is very hard. It's a very Labor seat.
Yes, that's right. Well, I really enjoyed the experience on the Fremantle campaign. I learnt a lot. Obviously, I was doing it for the first time, but it was really great to get out in the community and be chatting to people. And that's the part of the role of being a candidate that I love the most, is talking to locals about the issues that are important to them. And I guess that's why I want to do it all over again, is to get to know the issues in my local area. I'm a resident of the Bicton electorate, so getting to know what is important to the people in my own community, I think is really a great opportunity and very exciting opportunity, and I'm looking forward to it.
Congratulations on being a new mum, but it's going to add a lot more pressure to your campaign.
Yeah, it definitely is, but I think it's really important that women are encouraged to be in the workplace and have careers and also raise a family at home, and I look forward to doing that just like many other mums are already doing in WA, so I'm looking forward to it, and I've got great support around me, my parents and family and friends happy to pitch in and help out, look after Noah while I'm on the campaign trail, so and I'm sure he'll be happy to come along and be a part of things as well.
What are the issues that people have told you that they want to be solved, which is not currently being looked at the moment?
I'd say the biggest one is jobs. Obviously, coming out of the coronavirus pandemic, hopefully we'll stay on the right side of things and won't hit a second wave like it's happened over in Melbourne. But I think just coming out of that, the biggest thing people are worried about is jobs. People are appreciative of the government support from the Morrison government that's helped them to get through this period. But I think now is the time where things will get really tough, and people just want to know that their jobs are going to be secure, and they're looking to the government to help out small business.
You are an incremental part of City of Melville. You back row 8.
Yep. I've always been behind row 8 and 9, and that's probably something else that you just asked what the local issues are, but jobs. But in this area in particular, row 8 and 9 is something that heaps of people tell me that they want to go ahead to reduce congestion on our roads, make our roads safer, and ensure that the trucks can get to the port without having to stop at numerous sets of traffic lights.
How are you going to beat the 89% Premier?
Yeah, well, we've got a big task ahead of us, but I think I'm just really focused on doing what I can here in Bicton, getting to chat to as many people in the community as possible, meeting with community groups and individuals and small business owners, and doing what I can here on the ground.
What are the specific challenges that you are facing further up in the campaign? Because this is just the beginning. This is going to be a 6-month marathon type.
Yeah, we've got a while to go, but I think it's great that we've had an early start. So we've had a couple of months already of campaigning, and we're continuing to build a campaign team and to work towards next year's election. So it's great that we've got such a long lead in time, and that will give me a decent amount of time to be able to meet with as many people as possible and to be out listening to locals and hearing the issues that are important to them.
Apart from row 8 jobs, what are the other issues that you have identified that you think the government has not addressed at this point?
At this point, I'd say we need more police. Something that quite a few people have raised is crime, especially in the Bicton area at the moment. There seems to be quite a few break-ins, both into homes, businesses, as well as vehicles. So people would like to see more police on the streets to be able to fight crime and really get on top of the crime that's happening in the suburbs.
What are the evidence that suggests that there are not enough police presence in your area?
I think just the number of break-ins and the amount of crime that's being taken place. People are often saying to me, well, why is there so much crime happening? And I think if we had more police, they'd be able to respond quicker when people call them and make sure that the criminals are being dealt with and, make sure that they are being dealt with in an appropriate way.
What's the message for young people who are interested in politics and think, I'm not so sure, should I get in or not?
Yeah, I'd just say to young people, give it a go, get involved. You know, if you're interested in politics, then yeah, go for it. I think, you know, people underestimate what young people can bring to the table. I think we definitely need experienced people that know what they're doing, people that have been around for a while. But I think that needs to be balanced with young people who have fresh vision and new ideas. So I'd say anyone who's thinking about it, give it a go, and yeah, let's do it.
And now here is AMA WA President Dr Andrew Miller's weekly commentary on the latest developments of COVID-19.
Hi, thanks for your time. Very disturbing what's happening in Victoria at the moment, and the way that we respond to that in other states is really important right now. What we're hoping is that the Victorian spread has not, through interstate travel, managed to get too far around the country. In Western Australia, we've had a border which has been restricted, but still a lot of workers have been allowed to come in. Some of them have not been having to quarantine, depending on where they're going to. And that was a reasonable thing to do based on the need for the worker and there being no community spread. The trouble with community spread is you don't find it until a couple of weeks after it started to happen sometimes. And this is what's gone on in Victoria. So that's why it's so widespread now in the community. And this second wave that we're seeing is not based in returned travellers, but in people in the community who have no idea where they got it from. So fingers crossed we made our borders harder to get through in time, and we don't have too many little time bombs of COVID sitting around in Western Australia that are going to take off. We've seen the tracking and tracing capacity in Australia is not that high, 40 or 50 cases a day for a bit more than a week, and it starts to get overwhelmed with the number of contacts that you need to follow up because it becomes exponential. So we've got 1,287 active cases in the country at the moment, 50 of those in hospital, overwhelmingly in Victoria, around 15 of them in ICU, and some of those people are going to get very sick indeed, need ventilation. Some of them won't survive, unfortunately, and some of them will go on to have long-term disability, which is what we're trying to avoid on a big scale throughout our community. And what we're seeing with this plan of just allowing little outbreaks here and there is that they have to be very little indeed to keep them under control and prevent you having to go back into lockdown. Phase 4 is pretty good. The fears evaporated from the West Australian community. Everyone's enjoying the opportunity to engage in a bit of domestic tourism or engage in a bit of work. Some people still suffering, we have to support them. But right now our focus is on the poor Victorians and the support that we can offer them. We're helping them with their tracking and tracing and making sure that we don't get the same problem here, so that we also need help rather than being able to help others. One really disturbing aspect in Victoria is the number of healthcare workers that are infected. Around 17% of the cases over there are healthcare workers, and they're only 10% of the population. They're catching it at work from other healthcare workers, and we need the OC health and safety people to be getting in there now. Let's not have any more arguments about what kind of masks or gloves or anything else. They just need to get in there with the experts and sort this problem out, and we need to learn those lessons for Western Australia. What changes do we need to be making to our hospital systems, our rostering, our workforce, our hygiene methods, our cleaning methods, our cohorting? Do we have different workers working different days that never see each other, so we've got redundancy? Because we cannot afford to be closing down hospitals like they're needing to do now in Victoria, because 200 workers in quarantine. They got multiple facilities affected. We cannot make these same mistakes. Now is not the time to be only just enjoying our open community. Now's the time to be doing the hard work to say how we're going to do it differently to what they've done over there in Victoria. Full respect to them, very difficult problems to solve, but we cannot pretend that this could not happen in Western Australia. And right now, I'm certainly not confident that we would do it any differently on the front line to what they're doing over there. So love to them, and full respect to everyone who's working very hard to try and solve this terrible problem that they have. It's been a great wake-up call for the rest of the country. We've got 12.8 million cases worldwide, 570,000 deaths now, unfortunately, from this horrible disease. We're seeing other countries managing it terribly, and countries that should know better. You know who I'm talking about. And we're just very grateful that our leaders do listen to public health, but it doesn't mean that we're going to take our eye off the ball, and it doesn't mean that there are things that cannot be improved, because there's a lot out there that we can be doing better if we really listen to the people who are on the front line doing the job, the GPs, aged care, the regional people, ICU, and all of those who come into contact with these patients, whether they be doctors, nurses, allied health, all of the support staff. Everyone's appreciated, but mostly we appreciate those in the community who understand the importance of keeping this under control for as long as we possibly can. Because if we can get through to spring, if we can get through to a vaccine next year, if we can get through to a decent treatment that someone could be on the verge of finding somewhere, then that will make all the difference to our community bouncing back in every respect. Thanks for your time.
Dr. Andrew Miller there, and that's Western Perspective. We'll be back the same time next week. Until then, Ivan and Sarah, back to you.
Thank you, Taylor. And that's our weekly news and current affairs. We have the latest news on our website and social media pages.
No matter what you're watching, please take care and have a pleasant evening.
Good night.